Hi, welcome to Anatomy with Mo. Today we'll be talking about the lumbar spine. So your lumbar spine sits between your thoracic spine, which should be here, but it's been dissected on this specimen, and your sacrum. So the lumbar spine itself has 5 vertebrae. This is your L1, L2, L3, L4, and L5. So these vertebrae all consist of your vertebral body here. That's your vertebral body, which is thicker in the lumbar region. This is your spinous process. If you was to touch your spine, that's the region you'll feel is your spinous process. This is your transverse process here. These are your attachment sites for your muscles and ligaments. For example, your multifidus, intertransversarii muscles, and your quadratus lumborum. This here is your pedicle here. That's your pedicle. And this here is your lamina. Then we've got your something called superior and inferior articular facets. So this here is known as your inferior articular facet. This here is known as your superior articular facets. These facet joints are known as your facet joint. Also, you could call it a zygopophyseal joint. The lumbar spine also has ligaments, and these ligaments here are this one is known as the supraspinous ligament here. And on this specimen, it's not shown. We should have something called the interspinous ligament between adjacent spinous processes. This ligament is known as the intertransverse ligament, which is attachment sites for all of these transverse processes. Then here, we've got something called your ligamentum flavum. That's the ligamentum flavum here. That's another ligament. And then if we was to look at it in this view, we've got something called the posterior longitudinal ligament here, and this is known as the anterior longitudinal ligament. Sitting between the lumbar vertebrae, we've got something called the intervertebral discs, also known as your lumbar discs. So your lumbar disc sit between each vertebrae, and this here has a structure known as your nucleus pulposus, and this is known as your annulus fibrosus here. Then in the middle here, we've got something called the vertebral foramen, in which we've got your spinal cord passing through. This here is known as the intervertebral foramen. This is where we get your spinal nerves coming through. So when somebody has something called a herniated disc or a bulging disc, what happens is we've got your nucleus pulposus and your annular fibrosus here. When there's a weakness within this annulus fibrosus, the gelatinous structure, the nucleus pulposus, protrudes out and compresses on your nerve roots. So it will protrude here within this region, and that will cause symptoms within a patient. Also, when a doctor or a surgeon is doing LP, also known as a lumbar puncture, the common site for them is your L3, L4, which is here, and then we got your L4, L5. The reason they use these specific regions is because the spinal cord ends at the level of L1, L2. Therefore, these are your safe zones to do the lumbar punctures. Thanks for watching.